Program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions and get an inside look at the latest in healthcare, medical, technology, and treatments. This is Rex on Call. Welcome to Rex on Call live on WRAL. I'm Sharon Delaney for Rex Healthcare. Today we're talking about skin cancer and dermatologic problems. If you're watching us live and have questions about skin cancer or other dermatologic issues, call us now, 919-744-3876. Your questions could be answered on our program by our experts. The physicians taking your questions today are Dr. Yael Podnos, Director of Surgical Oncology at Rex Hospital, and Dr. Amy Fox, Associate Medical Director of UNC Dermatology Clinics. Again, to call us here at Rex on Call, just dial the number on your screen, 919-744-3876. If you're watching us as we're streaming live on WRAL.com, you can email your questions using rexoncall@rexhealth.com and find us on Twitter and send us a message at RexHealthcare, #RexOnCall. There's almost nothing nicer than Carolina blue skies on a sunny day here in North Carolina. But with those beautiful days comes the risk for skin cancer. The statistics do not tell a good story. As it stands, 1 in 5 Americans will develop skin cancer in their lifetime, and melanoma is now the most common form of cancer in young adults. We hear the warnings: use sunscreen, wear a hat, because the consequences of not heeding those warnings can be devastating. For one woman who grew up on the beach, she's now paying the price battling melanoma. The day Sarah Johnson was diagnosed with melanoma was bittersweet.
That day was the worst day of my life and the best day. My husband actually proposed on that day.
Sarah says the proposal was a wonderful surprise, but what the doctor told her earlier in the day flat out blindsided her.
I had skin cancer and it was melanoma, and she continued to go on, and after that I didn't really hear anything else. I just remember hearing cancer and melanoma.
That was in 2007 while living on the Outer Banks. She had a procedure to remove the cancer. But shortly after she and her husband moved to Raleigh 2 years ago, that same area around her eye started to darken. She came here to UNC Dermatology and Skin Cancer Center to see Dr. Amy Fox.
She did a biopsy and it came back positive for melanoma.
Reflecting on her childhood in Florida, Sarah admits she was a beach bum.
Blonde hair, blue eyes, fair skin. We didn't know as much as we know now.
Sarah is thankful for her supportive husband and for Dr. Fox, who successfully removed the recent melanoma. They're now just in observation mode.
We're fortunate here in Raleigh to have an amazing team of professionals.
Joining us now are Dr. Yael Podnos and Dr. Amy Fox. And Sarah's your patient, Dr. Fox. And she's doing well right now, isn't she, in observation mode?
She's in observation mode, which is the best place to be. Her story is representative of many other patients that we've talked to who have a very subtle early form of skin cancer. She has melanoma in situ, which is the earliest form of melanoma.
Okay. Now, at what point, Dr. Podnos, does the melanoma patient come to you as a surgical oncologist?
There'd be a couple instances. The first is when the melanoma would get deep enough where we need to do other evaluations, particularly looking at the lymph nodes. And other circumstances would be if the operation to remove it would be a little bigger than a lot of dermatologists would feel comfortable doing.
Okay. Do you all work collaboratively on a patient such as Sarah?
We certainly would. Mm-hmm. So, we would do the general skin surveillance. We would look for the problem spots. We would biopsy them and diagnose what type of skin cancer, and then we would send them for Dr. Podnos to do the surgical excisions for.
And that goes on for a long time, because even as the patients progress and get into this mode that this patient's in, I mean, my job as in somebody that I'd seen before would be to make sure this one doesn't come back, and a dermatologist's job would often be to make sure that another one doesn't come back, because one's biggest risk of getting melanoma is having had it.
Oh, right.
The same sun exposure that you got on your left arm, you got on your right arm, and so you still have to really
So it
monitor.
seems like you're at risk for it to just continue unless you're being very watchful of it.
Right, and so that's the role that we play. Is we have them in the office often, and we do full body skin checks, and then ask them to be really vigilant between appointments to look for some of the new evolving ones that would get them into the office sooner than their follow-up appointment.
In general, how often should someone be seeing a dermatologist for a skin check?
It's a great question. We get asked that often. It depends a little bit on your risk factor. So for Sarah, she's in our office about every 4 months or so because we're watching her very closely. For the average individual, once a year for a skin check. For those who've had skin cancer personally, non-melanoma, meaning basal cell or squamous cell, we want them in perhaps more often than that.
Okay. And for someone who's had a removal of some sort that you've done, Dr. Podnos, do you have a follow-up at that point too, just to make sure that it hasn't traveled anywhere?
It's tailored to the individual patient, so you really have to look at the depth of the melanoma, the skin cancer, also other things we look at, the mitotic rate. There are all sorts of different caveats, and so when we put the whole picture together, we would then kind of determine what the surveillance is and what kind of, how vigilant we need to look for things.
Okay. All right. Let's talk about identifying potential skin cancers, because you look around and if you're a freckledy person, you don't know,
It's hard to know
what would be what. So we do have a graphic that's very helpful, and this information is available on the American Academy of Dermatology.
Yes.
There we go. It's
Yes.
a great resource, and it's called the ABCDEs of melanoma. So let's start with A. Talk a little bit about the asymmetry piece.
So this is a mnemonic that we ask our patients to do at home, hoping that they're identifying problematic lesions early and then getting into our office so that we can take a look at them as well. So A stands for asymmetry, which means that one portion of the mole doesn't look like the other portion.
And it could be a freckle or a mole, or is it mostly with moles?
So it can be a raised or a flat pigmented lesion, either one. We ask our patients to treat them the same.
Okay, let's move on to B. So the border.
So the borders are the edges of the mole, and so what we ask our patients to do is look for moles that are irregularly bordered or that have what we call ill-defined, which it can look a little smudgy and not very clear. So that's one of the identifiers of problematic lesions.
Okay, and C is the color of it.
So most patients feel that this one is very intuitive. So if you have more than one color within a pigmented lesion, that can be a sign that that is a problematic area. So multiple colors within one. It can be tan, and then it evolves into a darker spot, but anything with multiple colors within it.
And then the diameter also is important. Is that a growth or changes over time?
So E is evolution, and we'll get to that one next.
okay.
But D is diameter. So essentially we ask you to sort of use a pencil eraser as a marker, a general marker for how big something is. If it fits underneath a pencil eraser, that's a reassuring feature. If it's larger than that, that may be a problematic area for you. And then importantly, E is the next one, and that's evolution. And that sort of trumps everything. If anything is evolving, changing over time, that could be a feature of something problematic that we would like you to get in front of your dermatologist to have them check it out.
Okay. A little bit later on the show, we're going to meet one of your patients, Dr. Podnos, who has Merkel cell, which doesn't really look like any of those things. What is that presentation like?
So Merkel cells can be a little enigmatic. It's typically a lesion that fits many of those characteristics that we talked about, in particular evolution. They evolve, they will change. And so oftentimes they're pink and they grow rather quickly.
And does it almost look like a bug bite or something of that nature rather than a brown freckle or a mole?
Yeah, most people mistaking them for bug bites at first, but it just keeps getting bigger, more raised, doesn't go away. They can crack and bleed, they become nuisances, and that's what will then get them in front of a dermatologist.
Okay. Obviously, we can't check all parts of our body. So with the American Academy of Dermatology, they have that information, and you should get your partner or spouse or whomever involved to do spot checks on your back, right? Do you see a lot of melanomas or squamous cells on the back?
All types of skin cancers exist on the back, and that's not a spot that we can survey. So we do ask that if you have a spouse or someone at home who can help you, that they do that. And then that's certainly something that you do between your visits with us, because then we do a full body skin check when you're with us. We check you from head to toe.
Okay, and most of these, are they preventable? these sorts of spots and things, maybe not the Merkel cell, but the basal, the squamous, the melanomas?
So the data suggests that skin cancer is very much induced by UV radiation over a lifetime. So yes, skin cancer is preventable if you take the right measures to prevent cumulative sun exposure over a lifetime.
Which means you have to start at an early age.
Yes.
With our kids.
Yes.
Yeah. So we're trying to right our wrongs when we were kids,
Sure.
but certainly for future generations.
If we knew then what we know now.
Right. Right. Okay, much more on skin cancer and other skin conditions. We're coming right back after the break to answer your questions. You can give us a call or send us an email. Welcome back. This is Rex on Call live on WRAL, and today we're answering your questions on skin cancer and dermatologic problems. If you have questions for our experts, call in now at 919-744-3876. If you're watching us as we're streaming live on WRAL.com, just email us your questions using rexoncall@rexhealth.com, and find us on Twitter or send us a message at RexHealthcare, #RexOnCall. Let's now go to some of these questions. Dr. Podnos, I've been reading more and more about immunotherapy for melanoma. Can you tell me a little bit more about this revolutionary, what the future is, really?
Oh, it's a great theme because historically, once melanoma spread, we didn't have very many options. The gold standard has historically been interferon, which is a very difficult chemotherapy to withstand. Actually, in my entire career, I've had 2 people complete the therapy.
Wow.
So now we have something different. And so we've noticed that there are certain melanomas that have genetic mutations, and we have medications that specifically target those genetic mutations. And they've shown fabulous promise. The problem is they're so new, we're not really sure how to use them yet. We know that they work well in a widely metastatic setting, but there are lots of great questions as, can you give it as a prophylactic thing in somebody at risk? At this point in time, we don't know. I suspect that those trials are maybe a year or 2 away from starting.
But there is great promise.
Oh, there is a fabulous amount of hope now for melanoma.
Okay. We have a question from Barbara in Raleigh. I have a solid brown mole for years on her hand, now a solid mole on her face that is also solid color, not spotted. She's curious what it might be.
It could be a couple of different things. So lentigos are little sunspots that come after sun exposure, and they're tan and dark brown, and what we would expect these spots to do is little to nothing. So we don't want it to evolve or change, have different colors within it, and so those would be reassuring features for her, but it might just be sun-induced changes.
Okay. We have a 3-time cancer survivor, Beverly in Spring Lake. She'd like to know, she's had breast cancer that spread to her lungs. She wants to be very, very careful about sun exposure. What would be your best advice for her? Dr. Podnos?
Avoid the sun. I mean, you have to live your life, but avoid getting suntan, sunburn, and part of that is big hats, sunscreen. Those cancers are really not, they didn't portend any more increased incidence of melanoma. So she's just like everybody else in terms of having to stay out and decrease her risk.
So she's not necessarily more at risk to be getting melanoma as another pre-melanoma patient, right? Have we talked about before, if you've had melanoma once, then you're like...
I mean, she has had a significant amount of sun exposure.
Yeah.
She's already had skin cancer, and so as Dr. Podnos mentioned earlier, that means that you've had some cumulative sun exposure such that you're at increased risk of having more skin cancer in the future.
Okay, so really good sun protection. All right, we have a couple of people here asking about skin tags. And could they be dangerous, or are they just annoyances?
So more often than not, they're just annoyances.
Okay.
And they're in the common locations where you get skin-to-skin contact and rubbing over time. So neck and axilla are common locations for it. They can be really nuisances.
Axilla?
Axilla, armpit.
Okay, there we go, armpit.
And so, they can be a nuisance to patients because they stay and they're irritating and they get tangled up in clothes. But more often than not, they're okay. We're happy to see them so that we can take them off.
You can take them off.
Yeah, sure,
all right.
absolutely.
Why do pregnant people seem to get them more often? It's like everything's out of control, right?
Because there's more skin-to-skin rubbing.
There we go. There we go. Okay. Do darker-skinned people need to be as precautious in the sun as lighter-skinned folks?
It's a common misconception. We were just talking about this earlier. As precautious may be a little bit of a misnomer. They do need to take precautions. You can get sunburn, certainly. It's harder to get sunburn, but wearing sunscreen and being thoughtful about your sun exposure is a blanket statement that we'd like to make for all patients. Certainly those that burn or freckle or have a history of burning easily, we'd want them to take some additional precautions, but that's not to say our ethnic patients shouldn't.
Okay.
And also one thing to keep in mind is also you can get melanomas and skin cancers in places where the sun doesn't necessarily shine. So, so whereas most of them are sun-induced, you can get them on your palms, on the bottom of your feet, in places where you wouldn't think that you could have a lot of sun exposure.
So, so you have to look everywhere, not just the spots, the areas of your skin that are exposed.
Right, and so this is why a lot of melanoma surveillance happens in a multidisciplinary fashion. So I do the skin checks, but your ophthalmologist is looking for pigmented lesions in the eyes, and your dentist is looking for troublesome spots in the mouth. And so
you can get melanoma in your mouth?
You can get melanoma in anywhere.
Wow.
And so that's a pretty common misconception.
Okay. All right, well, before we go to break, we wanted to give you some tips. Sun exposure is the most preventable risk factor for all skin cancers, including melanoma. You can have fun in the sun and decrease your risk of skin cancer. And here's some of these common sense ways to protect yourself from the sun, but you must remember to do them. Number one, generously apply broad spectrum water-resistant sunscreen with an SPF of 30 or more. Wear protective clothing, such as long sleeves, hats, and sunglasses. Seek shade whenever possible, especially between 10 and 2 in the middle of the day. Use extra caution near water, snow, and sand because they actually reflect those damaging rays from the sun. You can get your vitamin D safely through a healthy diet that could include vitamin supplements. And avoid tanning beds. Instead, use a sunless self-tanning product, but continue to use sunscreen on top of that as well. And know your spots. If you notice anything changing, growing, or bleeding on your skin, see a dermatologist. Well, coming up, we will answer more of your questions. Use the number on your screen to call right now, 919-744-3876. We'll be right back. Welcome back to Rex on Call, here live on WRAL. To reach us, call 919-744-3876. We're taking questions about skin cancer and dermatologic problems. But first, there is another kind of skin cancer that is relatively rare, but has tripled in the last 20 years. Today, we meet a Wake Forest woman who's battling a rare, aggressive type of carcinoma, a battle she plans on winning.
Getting some sun today?
Patsy Champion and her husband were enjoying their retirement with their new puppy when a few months ago, Patsy got a frightening diagnosis.
He told me that it was Merkel cell carcinoma, and it was a very rare and aggressive type of skin cancer.
Patsy had never heard of Merkel cell. Most people haven't.
And it looked just like a bug bite. But then I noticed that it started rising up to where it looked more like a cyst.
A simple bump on her left arm. Patsy, a stage 3 breast cancer survivor, showed it to her oncologist, who referred her to a dermatologist. The biopsy result was heartbreaking.
I'm trying not to be emotional, but hearing the word cancer after going through breast cancer is horrible. But again, I say, my faith in Christ is what's getting me through.
Patsy began 6 weeks of radiation at UNC Rex Cancer Care. But just 2 weeks before her treatment wrapped up, she noticed 2 lumps under her skin again on her left arm.
One thing I've learned about Merkel cell is it doesn't itch like a bug bite. It doesn't hurt, it doesn't burn.
The biopsy showed this too is Merkel cell.
I want people to know that if you get anything on your skin that looks like a bug bite, but in a couple of weeks it's not changed, go immediately and get a biopsy of it. People need to know. And the sad thing about Merkel cell carcinoma is that people have to get it in order for them to learn about it.
Dr. Podnos, Patsy says you warned her that Merkel cell carcinoma follows no rules. And you were right, it usually shows up in areas that are exposed to the sun. But in her case, it was under her arm, not particularly seeing the sun a lot.
Right, so it was an area, the first one was on the wrist, so there's a potential for sun exposure there, but subsequent ones have been under the skin, really, and probably involving the lymphatics.
Okay, so the next step for Patsy in her treatment?
Probably chemotherapy.
Okay. And so we hope that she does really well, and we'd like to follow up on her progress, but we wish her the very best, and we wish you luck in treating her. Dr. Fox, there are many other kinds of skin issues that you see in your practice. Can you go over some of the other things that you're seeing a lot of?
Sure, so we classify it in two categories. So non-melanoma skin cancers are basal cells, the vast majority are basal cells. And then second to that are squamous cells, and we think of them as fully UV-induced skin cancers. We see them in locations that have gotten UV exposure over a long period of time. So forearms and hands and face, ears. And then the other category is melanoma, and so those are the big three of what we see.
Okay, let's talk about sunbeds. And luckily in the state of North Carolina, there has been legislation that has moved forward to try and protect young people. As we pointed out at the beginning of the show, melanoma is one of the fastest growing kinds of cancer among young people. And it's a lot of it's the tanning beds, right?
It is. It is. And Dr. Podnos and I were just talking, it's a cultural phenomenon in our state that tan sort of equates to beauty. And what we want to do is start that conversation now, that when you expose yourself to UV indoor tanning, you get significant amounts of UVA, and that really puts you at risk. And the evidence is there, and it's well documented. And so now that we've got information out there to the public, we're asking people to make better choices. We've done a great job with legislation at protecting people 18 and under, but now we need other people to set a good example and not do that as well.
Because if the parent's bringing the child,
right.
Obviously the message hasn't gotten through to the parent.
And it's a start, but in other countries like in Australia, there's certain provinces in Australia where tanning beds are totally illegal because they've recognized this years before we have.
So what do you think will be the thing that's going to make people realize and maybe it's business over people's freedom to choose these things? I suppose it gets political at this point, but really it's a safety issue.
It is, but we've made huge inroads. It was a collective effort that took several years in the making to get the legislation passed here in North Carolina, and that's the first right step, is making the public aware that we're going to protect you with legislation, youth. And now the more events like this where we can get the public message out there that there are risks associated with doing this, and it really can result in melanoma later on.
And I've actually seen stuff going around social media.
Yes.
Young people who are showing the evidence, the consequences of what's happened after sunbed exposure. So
it might take a campaign like we saw with smoking.
Sure.
Or drinking. I think this is just another one of those risks that adults may choose to take or not, but at least they will know the risks.
Yes. Okay, well, we'll have our final round of questions right after the break. This is Rex on Call. Welcome back to the show. This is Rex on Call, and we are taking our final round of questions. Very quickly, there are other skin things that go on, like bug bites and ticks. Tick exposure is huge in the summer, right? This is something we should talk about?
It is. So tick exposure is something that we see our patients with all the time. They often ask us, well, what should I do? What should I be looking for? So you want to remove a tick if you see it as early as you can. And then you look for a targetoid rash and increasingly fever and joint pains. And those would be reasons to reach out to your either primary care provider or your dermatologist if you have one, because that type of situation might need some antibiotics.
Because then you also hear down the line of Lyme disease and these sorts of things.
Sure.
Also, eczema, rosacea. I know there were a number of people who were asking about that. Are there over-the-counter types of medicine that can help with that?
So in general, if we're talking about eczema, we want our eczema patients to use gentle skincare products like gentle soaps and unfragranced moisturizers, and do so pretty routinely. For rosacea, it's a little bit harder, but the message still stands: wear sunscreen, and then see your dermatologist for additional treatment options.
Okay, so a lot of people have lots of things to do. Check your spots, and we will have all of this information as well on Rex's website. So always consult with your physician about any health concerns, especially ones that we saw today. And if you're looking for a doctor beyond today's show, or you need a direct referral, you can call Rex HealthNet. That's Rex's free telephone information service. The number is 919-784-4490. We'd like to thank our phone bank for taking calls, and thank you to our experts today. And join us Monday, July 20th for our next Rex on Call. Our topic is summer emergencies and ailments. You can email your questions ahead of time to rexoncall@rexhealth.com. See you next time.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.